There you go, Fern.
Okay. Hello, everybody. Welcome to Health Insurance, Your Questions Answered. I'm going to start here with just a couple of caveats. This does not constitute official legal, financial, or medical advice. So this is just for folks' information, sharing from one human being who has gone most of my life without employer-sponsored healthcare, and had to get scrappy on the marketplace and looking into options with Medicaid. Um, and also as somebody who is a provider. So I am a licensed clinical psychologist. I accept here in Illinois Blue Cross Blue Shields plans, but what that means is I basically have each perspective, right? The perspective of somebody who is filing claims on behalf of my own patients, and also somebody who is getting healthcare of my own and hoping that those claims make their way where they need to as somebody with insurance. So I want to just start by talking a little bit about healthcare and how costs get set. Something that a lot of folks don't know is why healthcare is so expensive. They know it's expensive. I think the word has gotten out, but they don't know why. And I never knew why until I became a provider myself. So basically, the way that insurance works is an insurance company will take a look at what people are charging for a given healthcare service, an appointment, a test, a lab, and they look at what is generally being charged within that area. In a place like Chicago, there are so many providers. That's where I'm working. And so the average cost is higher. There's a few reasons for that. One of the reasons is that in Chicago, we are a very doctor saturated market. In other words, we have teaching hospitals. We have a lot of folks who are MDs or PhDs, fewer folks working with a master's degree or nurse practitioner or physician's assistant, things like that. And so that means that in general, folks are charging a higher rate commensurate with their degree level. But what insurance does is they say, cool, cool, cool. Whatever the average is that's being charged, we're going to give you like between 70 and 90% of that. We're just going to like give ourselves a little discount so that no matter what, as a provider, you are not making your full fee. Right? So can you see how that encourages providers to boost up their fee? And so that means people who aren't insured or who just aren't using their insurance, what a privilege and a blessing, they're the only mythical people who end up paying these full fees. And insurance says, great, because we have such a large network and we have so many folks that we can refer your way, it's just going to be advantageous for any provider, whether that's a licensed clinical psychologist like myself, or a primary care physician, or an OBGYN, or a foot doctor, whoever. It's going to be advantageous for you to be in network with our insurance panel. And so we can just cut down our own costs by taking the average amount that's being charged in your area and then giving ourselves a sweet, sweet friends and family discount for the cost of doing business with you as a provider. So that means that we as providers are incentivized to set costs high, knowing that insurance is going to cut some of that right off the top. Your provider does not set the amount that your services are worth. What they set is their full fee, and the insurance company, regardless of how much that full fee is, gives you the exact same rate. So I have some colleagues who charge literally $50 or $100 more per session. And for our insurance clients, we are paid the same. So that's one of those myths, is we think, oh no, is this doctor going to be more expensive than that doctor? And you might look at their website and you might see if they post their fees, and a lot of them don't. If they post their fees, you might see, wow, like people are charging all kinds of different rates. Is that going to mean that if I'm insured, that my rate is different? And the answer is, if you have insurance, no. And that is good news for you as a healthcare consumer, is that that cost has been lateralized. It is the same for people who are seeking services in your same area. So that's one of the places I wanted to start, because I think that's a source of confusion a lot for folks. But before I move on, are there any questions, spicy reactions to just that much? Okay. So we've established healthcare is expensive. Healthcare is expensive. You already knew that, but hopefully this is giving you some idea of why, and also why healthcare costs a different amount depending on where you live. If you're in a rural area, there's fewer providers. That average is being calculated based on fewer folks in that area. And competition means that prices go higher. So let's say you're in a situation where you incur some unexpected healthcare costs. Maybe you thought that you had coverage for some sort of service that you're getting, or a medication that's been prescribed to you. And then you find out later through the mail, you get some kind of bill and it's like way more than you were expecting. Or you thought that your costs were going to be $0 and you're paying the full amount. I want to talk a little bit on some of the things behind the scenes that are often the culprit. Again, this is not a guarantee that this is correct in your situation, but just based on my own lived experience, these are some of the ways that folks end up incurring unexpected costs. One of them is that you end up with an unreliable estimate of coverage. So whenever you are making an appointment, often they'll immediately ask for your insurance card. And they'll do that no matter what kind of insurance you have. That could be Medicare, Medicaid, that could be United, Aetna. They want to know, what's your insurance? And sometimes they'll give you an estimate. They'll be like, okay, great. When you come in, your copay is going to be $35. Or when you come in, you're going to be paying the full cost because you have a deductible, which means that until you pay X amount, there's no shared coverage by the insurance company. They're not kicking in any money for that service until you get to a certain point. Well, I know for myself, when I've called to get an estimate of benefits, which I do for every single person who walks through my door, that estimate, just me calling and saying, hey, a question as simple as, what's this person's mental health coverage? And how much are they going to be paying for an intake? How much are they going to be paying for an ongoing individual session? Do they have a copay? Do they have a deductible? What's the situation? There are many times that I will call and get inaccurate information. And that's not because I did it wrong. And it's not even because the person on the other side did it wrong. It's because the systems where information about your plan is tracked are so antiquated. And someone can literally look up your name in a system, and maybe they're looking at insurance coverage you had a year ago. Maybe they're seeing an unupdated amount for your deductible, and so they're going to misquote you how much you still owe. So that's a big part of it, is that sometimes that initial inquiry into how much that service was going to cost, your provider is getting faulty information and then passing that along to you. And that's super, super fun, BT dubs, as a provider, because I'm like, I looked this up. This is what I was told. And then, right, like folks get upset, and that makes so much sense. And sometimes it's just you get a wrong estimate from the very beginning. But let's talk about a whole other category of unexpected costs, and that is the relationship between the service that you got, right? You scheduled an appointment, you attended, you got an exam, you got some sort of blood work, you went to physical therapy, whatever that is. And then you leave, and you're like, usually when I leave a place, I know exactly how much the service costs, and I'm being asked to pay for it. And healthcare is real wonky that way, because sometimes it works that way. And sometimes you go, they can't tell you how much it costs, and they don't charge you right away. And so then you're in this like holding pattern. Your life moves on, you do other things. And so I want to talk to you about what's happening behind the scenes. So when you get any sort of healthcare service, a claim is generated. And that claim is like, I, as a provider, have claim to monies, hopefully monies plural, from this insurance company, right? Because I've been paid $0, or sometimes like maybe a copay, but there's a lot of outstanding money that I have claim to as a provider. So a claim gets generated, which is basically just a form with all of your information about your plan, your name, your birthday, all of your protected health information, the service that was provided, and then my information as a provider. So there's all kinds of numbers associated with being a provider that have to do with what kind of license you have, the state that you're in. So there's all these different numbers, and all of them have to be correct in order for that claim to make it to the insurance company. And you might be thinking, wow, this is happening all the time. How could those numbers possibly be wrong? They can. As somebody who has an electronic medical record system where things are auto-generated, that system is fairly faulty. And so frequently I'll get a claim kicked back and look at it and be like, oh, there's an obvious problem here. But I'm like one person working in a small practice. Imagine you're a hospital and there are thousands of claims being generated every single day. That's one way that you can end up incurring an unexpected cost, is that there was some sort of error on the claim. It never made it to the insurance company, and so it never paid out, which makes it look like you have an outstanding balance, when in fact, I know, I see the faces. In fact, that claim has not made its pilgrimage from your provider to the insurance company to that provider's bank account. And what a journey that is. So your claim can be rejected before it even makes it to the insurance company because there's some kind of error. If this is upsetting to you, good, right? Like, this is wild how unknown this tends to be. But there's a whole other way that your claim cannot get paid out, which is that once the insurance company receives it, they are allowed to sit on it for quite some time. So like, I just cleared, this is October of 2023. I just cleared some claims from January 2023. What? And that wasn't because I was just like a claim hoarder. You know what I mean? Like, no, these are my like very special claims. I don't want to submit those. No. That's because they made it all the way to the insurance company, but nothing happened with them, right? Like they're just parked, unprocessed. And so that's another way that you can incur an unexpected cost, is that once it gets to the insurance company, there's a delay on when it gets processed. And sometimes your claim gets denied on their end, but as providers, we don't receive that information until months later, which means now we have to try to reconnect with you. And you've like lived lives, been on vacations, had children by now, and we're coming back to you like, hey, you remember that appointment when you had that cold back in January? We just wanted to like reconnect on that. The claim never got processed until now. And so now you owe us this unexpected, really large fee. And you're like, what? I forgot I even had that cold. How is this happening to me? So I'm not going to leave you hanging. Let me talk to you about what to do with that here in just a moment. But for now, we're just absorbing ways that this can go wrong. The claim it never makes it to the insurance company. It makes it there, but it's delayed, which means that you're hearing months later about a cost that you didn't know you were going to have to pay. Or it just gets denied by the insurance company because the insurance company is like, I don't think they needed that healthcare. And you're like, I sure did. I already went to the appointment, but they can deny it later. So that's a way that happens. And here's another really sticky wicket. As providers, we don't know when your insurance is deactivated, when you get new insurance, that insurance expired and now you have a new card. We don't like get alerts in an inbox somewhere like, FYI, you need to get a new card from so-and-so, which means we rely on you as the patient to tell us, hey, I have a new insurance card. Hey, I left my job. I know, I see the faces. So it's like, oh, you don't even know? Yeah, mama doesn't know. I'm always relying on folks to tell me, hey, my insurance has changed. And people like don't get excited in the morning about calling their provider to say, hey, my insurance changed. That's not something that motivates people. Whenever insurance comes up, like people feel avoidant, they feel sad in their heart. They don't want to reach out. And they have a lot of times inaccurate knowledge that like there's some sort of really well organized system that of course would inform your provider that your insurance changed. And I'm here to tell you, and I'm so sorry, that system does not exist. Which means like, okay, fine, great. You don't know, you're waiting on me. But the problem is if you're someone who's like going to weekly physical therapy, or you're coming to see me weekly for therapy, you're filing many claims, right? Like multiple in a month. And I'm still submitting claims because I'm like, they've still got insurance. This is no problem. And then come to find out later, and sometimes many months later, oh no, that person's coverage ended in July. And I'm just now hearing about it in October. And that probably already sounds really bad. Like, oh no, that's like 3 whole months of physical therapy that we don't have any coverage for. But here's what makes it worse. I'm so sorry. There's no like, but on the bright side, okay, here's what makes it worse. Once a provider submits a claim for a service, even if you didn't have coverage, we can't go back later and be like, JK. Our contract with insurance companies says that once we bill for a session, that fee is set. We cannot discount it for you. We cannot waive it. So if you end up not having coverage, you have to pay the entire amount, which really, really sucks. And because of the delay in processing claims, you've often received other medical care that you didn't realize wasn't going to be covered. So you're just incurring costs. So that's some of the myriad ways that things can get wonky on the back end, resulting in extra costs that you weren't expecting. But now I'm going to try to cheer you up with some procedural ways. They're not like interesting, but they'll be interesting to you because they might save you some dollars to help those costs if you incur them unexpectedly. So, thing one that you can do to avoid unexpected costs is to keep closer track of your coverage dates. How boring, but I invite you to do it. Something that I've started doing for myself is once I get my little insurance card, I put in my calendar like a month before it expires, insurance expiring in 1 month. Inform all providers so that they stop submitting claims and so that I don't end up with unexpected bills. And it's also like if I've been going to a service, you know, maybe it's somebody that I go to see regularly, I know like, okay, we're about a month out from that change. And maybe I like schedule an appointment a few months after that, just to make sure that everything gets in the system with my new insurance. So that's one strategy. And again, this is not official advice from like a medical provider right now. This is just like as a fellow human in the world, word to the wise. The other thing that perhaps you've started to glean from this is to communicate immediately if you have changes in your coverage. So if it's just a matter of, oh yeah, I've got the same insurance, but that card expired, here's my new one, they will need the new card. Okay. They need that on file because they need to put that information correctly on your claim so that it makes its way to the insurance company and gets paid out as expected. If you are anticipating leaving a job, or you know, I just left this job, oftentimes you'll continue to have coverage through the end of that month, though that's not a requirement, so you'll want to make sure of that. But you'll want to alert any of your providers, hey, this coverage is coming to an end. Now, if you have, so those are some like preventative methods. Let's get into, we weren't able to prevent it, and now I've got this big old bill I don't know what to do with. If you have employer health insurance, and this can even be like union health insurance, it's insurance that you get through your job, any sort of employer health insurance, involve your HR manager or benefits specialist if you work at a larger corporation. that person is in charge of selecting the exact plan that's offered by your company. So they are going to know just as good as anybody, including the insurance company, what is in your exact contract. Because every contract is different. There are as many Blue Cross Blue Shield, United Healthcare, Aetna, Ambetter health plans as there are companies. So they're all a little different. There's carve outs, meaning like, oh yeah, we don't want to cover that because they're trying to reduce their expenses as your employer. And so your HR folks are usually the best people to go to if you're struggling to get information, or you're not sure why you have a certain cost, or you're not sure why you don't have certain coverage. That's a person to go to, because usually that HR person has contact with an insurance broker. And an insurance broker like sells the insurance to your company. And they have every motivation to want to keep your company or your union, whoever it is, subscribing to that particular plan. And so they want to provide better customer service. The health insurance company's motivation is to reduce their costs. And maybe you're reading between the lines of what I'm not saying. Their motivation is to reduce their costs. Think about it, right? So oftentimes going to an HR person so that they can go to the insurance broker is a better plan than approaching the insurance company themselves. Not always, but it's something to think about as you incur these kinds of costs. And by the way, a whole other reason for that strategically is if there's a quorum of people who are all like, for example, why don't we have mental health benefits? Why don't we have better mental health benefits? And they start to get that feedback again and again and again. They might decide, you know what, it's worth it to us to stop getting these calls and to just select a plan that has better coverage. If you are somebody who is on Medicaid or Medicare, that's a little different than a marketplace plan where you are still purchasing insurance from a private health care company like Blue Cross Blue Shield or Aetna, somebody like that. The good news about being on Medicare and Medicaid is that the customer service is a lot better. And basically what the government is doing is serving as a liaison between you and the provider. So I always recommend, if you're on Medicare or Medicaid, call the number associated with your account. Those customer service reps tend to be the most helpful because they are trying to answer questions for folks receiving the healthcare that the government is paying for. And they're going to be very motivated to make sure that those costs are low because they are cost sharing with you as the consumer. Here's another one. So let's say you are seeking out a service that requires something called a pre-authorization. So your insurance technically covers it, but they want your provider to kind of like make a case that you really need it. And these are the games we play, right? Like it's both covered and you can't access it immediately. So you need somebody else to say in a letter or filling out a form that you really do need this service. It is medically indicated. Let's say you're getting gender affirming care. Let's say you are getting an elective hysterectomy or something like that. You might get that initial request for pre-authorization denied. You might get it approved, and then on the back end, you discover, wait a minute, this didn't go through how I thought it was, and now I have this big bill I wasn't expecting. Ask your provider to submit it again. To submit the pre-authorization, to submit the claim for the service that you received, ask them to submit it again. It creates extra admin work, especially for larger systems, to have to do so. But I can tell you, as a very small system, more often than not, and this is just the like magic sort of ethereal part of health insurance, is I'll submit the claim, it gets rejected or denied, which are two different things, but not for the scope of our time. And I'll get it back like, that's weird. This person was literally covered for this same service last week. Why not this week? I'll resubmit the claim and it'll get covered. So sometimes it's just a matter of resubmitting and getting a different response. So I always recommend, as you're advocating for yourself, ask them to resubmit the claim. It might be that the second answer is a better one. The other thing that oftentimes folks don't realize is it is appropriate to ask for a payment plan. It is appropriate to ask for a payment plan. If you are receiving healthcare from a really large system, like a hospital, oftentimes the folks who work there are, their motivation is to collect as much outstanding fees that are owed to that entity as possible. And so they are de-incentivized from telling you, you can delay payment through a payment plan. And so they might rely on you as the patient asking for that. But it is within your rights to ask for a payment plan. And to even say, this is how much I can pay each month, and let them get back to you about that. That's one of the ways that folks end up having to file for bankruptcy or end up in these really precarious situations, is that healthcare costs will be sent to a department within these large systems where their entire role is to collect the outstanding fees owed to that institution. And sometimes it's easier because you're sitting here feeling guilty, you're afraid, this system is opaque, you don't know what you're entitled to. So you just think, oh my God, okay, I'm just gonna have to fork this over and make this work because I keep getting calls every day, or I'm getting all of these red flags on my account to schedule something new. Ask for a payment plan. Depending on the system, they might have a program. Not every hospital or institution does, but they might have a program where they can reduce your fee, right? Like they might have a grant that they can kind of like apply to your account to give you a bit of a break on what's owed. They might be able to give you a payment plan that allows you to pay it off over a few months. But always ask for that if you get to the end of the road, you really do owe what you thought you owed, and it's too much for you at that time. And don't be afraid to ask, like, okay, if you're not able to authorize a payment plan, can I please speak to someone higher up in your system who might be able to? Like, who's the administrator in this situation that might be able to authorize those things? Because that's often language that's used if you call any of these places. Like, I'm not able to authorize fill in the blank. Okay, cool. Who does? Let me speak to them. So those are some strategies if all else fails and you really do have to pay an unexpected large amount for healthcare. Let's see. I want to shift now into talking about some general tips and tricks for selecting a healthcare plan. And these are going to apply for folks who are looking at the marketplace, the Affordable Care Act marketplace in your state, all of which have different plans available, but I'm going to kind of give you some guidelines for whatever they do have available. This applies if you are getting insurance through your employer or a union that you belong to. So first, I want to explain the difference between an HMO and a PPO and who might benefit. And you might be like, Fern, what does HMO stand for? I'll be honest with you, I would be Googling that just like you would, because I don't remember. But I can definitely explain it to you what the difference is. So an HMO and a PPO. Let's start with the cream of the crop, the golden goose that is a PPO plan. I actually do know what that one stands for. It's a preferred provider network, but spelled with an O. I don't know what the O word is. A network. Preferred provider, a network. Sorry. I have to make this funny somehow because this is like, right? It's so, I don't remember what the O stands for, but it's definitely preferred provider. And basically what that means is that anyone who is paneled with that insurance is going to be in network for you. So in the case of mental health, we all have to apply to be in network. We have to apply, and it's called the paneling process, where they have a panel of providers of all the different specialties, and you're applying to be part of that network of providers. And so if I apply and I ultimately am selected to be within network, which I'm so lucky I was, then I am in network for all PPO plans. So somebody who's got, Blue Cross Blue Shield PPO from SEIU, somebody who's got it from working at a university, somebody who's got it because they have the fancy corporate job, they're working for Instant Pot. All of those people can come see me, no problem, because PPO means anybody who is in network is available to you as the insurance holder. So that one's the easiest one to explain. And I'm going to contrast that with an HMO, and then I'm going to talk more about the selection process. So PPO means I can go to any hospital system I want, any provider who's in network. But an HMO is basically the insurance company saying, would you like to save some money? Boy, do we have a plan for you. How about instead of seeing anyone who's in network with us in any hospital system, we are now going to confine you to just one hospital system. So here in Chicago, that's less of an issue because we have North Shore, we have Advocate, we have Rush. We have all of these major hospital systems, Northwestern, that you can have an HMO plan in and still have a pretty good selection of providers to work with. And so HMOs, every person in that network is going to be connected to some kind of system, usually a hospital system. So if I go to the hospital's emergency room, if I go outpatient, I've got to go to Advocate Illinois Masonics outpatient clinic. I have to go see their OBGYN, their dermatologist. The thing about HMOs that's oftentimes not understood is that more of your like niche providers, your specialists, are likely to not be in network. So folks like mental health providers or chiropractic or folks who are frankly disenfranchised by Western medicine, sorry for our slight political plug, are not going to be in your HMO plan because we are not affiliated with hospitals. We don't work for large institutions. We are small systems. And there is a great cost and a whole like paperwork infrastructure that you need to be an HMO provider. So unless you're attached to one of those major institutions that already has all of that infrastructure, you are unlikely to be in network. So HMOs, you can save money on your premium. That's your monthly payment toward your insurance. And something to keep in mind is that depending on the folks who are going to be on that plan, you want to make sure that their most regularly occurring medical services are in network. And so, yeah, we can talk about that. HMOs are the most advantageous to have in larger cities that have large hospital systems with many providers, many satellite clinics, many specialties. If you are in a smaller area, you will either be traveling some distance oftentimes, or you just might not have a dermatologist, for example. That's one of the specialties that's just harder to keep up with. There might be a lot of turnover in that role. And so there's just sometimes that you don't have a dermatologist that's available to you, even though you have coverage for it. So this is definitely not me saying if you are in a small area, you can't have an HMO. I'm just trying to present you with information that might be helpful to you. So as you are selecting your plan, likely you're going to be comparing plans based on the monthly premium, the monthly cost, your subscription fee, if you will. And that's a fine way to start, right? We all think in terms of monthly bills, our monthly budget. But I would invite you to consider 3 more things. One of them is your prescriptions. If you are somebody who is not currently on any prescriptions, then yeah, looking at that monthly cost might be beneficial to you. But if you know, I've got these 3 prescriptions that the entire duration of this plan, I'm going to be needing, you want to look at the prescription coverage. And you can find that. I was even thinking of like, how could I show y'all? But I don't have a good way to show you without like a HIPAA violation. And that's not what I'm trying to do today. So if you click further into the plan, whether it's in the marketplace or as you're comparing options with your employer, you should be able to see the prescription costs, and you'll be able to see generics and non-generics. And for some folks, depending on what medical condition you have, you might not be somebody for whom there is a generic medication for you. And some insurance plans really incentivize you to get the generic. So they'll cover the generic at like 90 or 100%. But in the fine print, it's like, if it's not a generic, we cover it at like 10%. So you really want to look at that as you're selecting your plans, because those are your most frequently utilized and recurring costs. You also want to look at the appointments that you most regularly go to. So I'm somebody who's assigned female at birth. The things that I most regularly go to are like my OBGYN, my therapist. I am a therapist. I have a therapist. I know therapists. I'm just in a therapist lifestyle. Those are the people that I see the most often on this planet. So I want to make sure that my healthcare coverage, which is under the specialist category, is at a rate that I could afford week to week. So if that specialist fee is $75 a session and I'm multiplying that times 4 and starting to feel overwhelmed, even though that's a lower premium, a lower monthly cost, I might decide that is not the plan for me, because the services that I get most often are at this higher fee. Physical therapy is that way too. So you want to make sure that you're thinking of, what are the appointments I most regularly use? And lastly, you want to think about any barriers to accessing healthcare. So you might have a really low monthly cost, and you might be like, done, select, just like student loans. I don't care what it is, how many of my future children I'm signing away, lowest monthly payment, thank you so much. Healthcare is different. So we want to make sure that we're thinking about, okay, whatever that cost is, what is the deductible? Is there a deductible of $1,000 or $8,000, or I've even seen as high as $12,000, such that I'm going to have to pay out of pocket $1,000 or more before this insurance kicks in and splits the cost with me in any way? That might not be worth my low monthly fee if it basically means that I am now paying a low premium amount to like never go to the doctor because it's so expensive, because I have to pay for everything else out of pocket. So that's really something to consider, is that deductible cost. You also want to think about, does your plan cover routine medical care, or sometimes it's called preventative care, at no cost to you? Boy, is that a benefit. If you're able to go to your primary care physician, if you're able to get basic labs and it's no cost to you, that's a real benefit, because it means you don't have unexpected costs and the barrier to going to see a provider is very low, right? Like with my purchase of my monthly premium, I can go free for a checkup, a physical, a pap smear, right? Like whatever I'm needing. Sometimes that preventative care being covered reduces the overall financial burden of a plan. And finally, you want to look at your emergency room fees. No one likes to think of this, but if you are in an emergency, you don't want to be in a situation where you feel like you can't go to the hospital because you can't afford it. You want to look at, is that emergency room fee, sometimes it's, you have to pay up to $1,000 out of pocket and then the insurance kicks in. Sometimes there's separate deductibles or fees, and you want to know what those are so that you are not in a position to be choosing between going to your nearest care facility and a bill that you can't afford that's going to bankrupt you. So be sure to take a look at those emergency room fees and make sure that it's a cost that feels maybe still out of reach for you, but like reachable. Because again, if you're paying a low monthly fee, but then you're not setting aside money for those unexpected costs, you've now purchased a plan that you feel like you can't use. And psychologically, that becomes a real burden over time, and can be anxiety inducing at the very worst time when you need the most care.
I have a question.
Yeah, Mary.
You may not know the answer to this. But in terms of like emergency room care costs, would that, or maybe this varies, would that include if you needed an ambulance? Because I know like they can charge you for the ambulance ride alone. Would they only start it with just when you're in the room at the hospital and whatever services they provide there, or would they include if you needed to be taken to the hospital?
That is an excellent question. They generally do not include ambulances.
Cool.
Yeah. And by the way, this is something that like only someone like me would actually do. It's worth looking into calling your local hospital that you are most likely to go to and asking like, who is your ambulance provider? Because oftentimes, especially in smaller areas, they will subcontract that out to a whole other company who's not affiliated with the hospital, who sets their own fees. And those fees can be quite high. Sometimes the hospital, especially like in a large city, they've got their own folks, but when you call 911, you want to know who they're dispatching. And that's a whole way that you can incur unexpected costs is by having a subcontracted ambulance arrive to pick you up to go to the emergency room, because those fees are very different. So yes, that is that. So I don't know for a fact exactly what those costs might be, but generally speaking, the answer to your question is no. The ambulance ride, your transportation is not covered. It's just for once you enter the emergency room.
Great. Thank you.
Yeah. Great. Generally speaking, the best coverage, and this goes with all the caveats, right? Like I'm not a physician, I'm not an insurance rep, I'm not a financial advisor, I'm not a makeup artist. I always like to throw one in there that's just like a little random. But just from human to human, generally speaking, the best coverage is the most popular coverage in your area. This is not the time to be a recovering hipster like myself and be like, oh my God, but everybody has Blue Cross Blue Shields. I want like something unique. No. You don't want unique insurance that no one's ever heard of. You want the insurance that everybody has. And you can Google in your state or in your area, what is the most frequently utilized or has the largest network of subscribers insurance in your area. And that's the one to get because it's going to have the most providers in it. If it's a niche insurance that no one's ever heard of and it's got like the lowest premium, but it has like 3 doctors in it, and sometimes those doctors get sick or tired of taking that insurance, and then they're like off the network, and now you're down to 2 doctors for all the other people who chose that inexpensive insurance, right? Like that can mean that you don't have the coverage that you're paying for. So that's a good one as you're shopping, is to look at, okay, who's in network here? And if you're working through the Affordable Care Act marketplace, like healthcare.gov, you'll be able to see who is in network. And even if you don't already have providers that you're looking to work with, you can look up by specialty and just see the numbers, like, is there exactly one primary care provider in network with this thing? That's not a good sign. But if it's a popular insurance, generally speaking, they're going to have a larger network, which is more selection for you. You don't want to be vulnerable to the high turnover of a low reimbursing insurance company. Okay. I think that is just about all that I plan to say during this time. So what I want to do to organize us is ask, do folks have any questions about things that I just said that would be helpful and beneficial, maybe for other folks listening to this recording later, that you feel comfortable sharing? And if not, then we can wrap up our recording and move into our Q&A that's just us chickens.
Me and Emily. My question is, and I think you answered this, but I just want to make sure. So healthcare.gov, that's the marketplace. And Medicaid those are two different things, even if one might be able to go to healthcare.gov and then get sort of rerouted to get to Medicaid. Is that true?
That's
So
true.
the marketplace doesn't know anything about my Medicaid.
Nope.
They're two different entities, and that's maybe where I run into some confusion. Okay, good to know.
Yeah, it's genuinely confusing because you can get information about your eligibility from healthcare.gov, but basically your options for lower cost health insurance are, if you're eligible, Medicare or Medicaid. And if you are eligible in the marketplace, they will have what's called subsidized plans, which is basically the government kicks in some money so that your overall premium is lower each month, but it's subsidizing you getting better health care. But the reason that those are different is that Medicare and Medicaid is government sponsored, like single payer system. That's why when you hear politically, like, we want single payer, that's what that means. The single payer is the government.
We'll see.
Right? You're not sharing the costs.
Yeah.
The government is responsible for reimbursing those services.
Mm-hmm.
And private health insurance is a shared expense, multi-payer system where you as the patient are paying a little bit, the insurance company is paying a little bit, your provider is paying a little bit, PS, because remember, they're never getting their full fee. So they're also kicking in a little bit. And then also sometimes if you have a subsidy, the government is kicking in a little bit as well.
Okay, thank you.
Yeah. What was your question, Emily?
Yeah, my question, you were talking about different ways that you would end up with a bill that you don't anticipate. And so I've been in the experience where I've found out that it was all down to the claim being submitted incorrectly, but it took months to get to that point. And I'm just wondering if there's any way to like, find how to figure that out faster. Is that going to the insurance? Is that going to I often am wondering who should I be talking to? Should I be talking to the provider? Should I be talking to insurance? Should I be talking to some unknown person that I don't even know? Any thoughts on that?
Well, I could give you a more specific answer if we went more into like what exactly it is, but let me just give some general general ideas about that while we're on the recorded section. The shortest answer is the saddest answer, which is no, there's not a lot you can do. However, there are ways to get status updates. So anybody who has an electronic medical record system, an EMR, can look and see, has that claim, well, basically they can see where the claim is in the process. And there's 4 different places it can be. This might be useful. So it's a good question. 4 different places it can be. So the claim has been generated is stage 1. So usually the electronic medical record system will automatically input everyone's information into this form. So now the form has been generated. Then it goes through a process where basically there's like a checkpoint that your claim has to go through before it makes it to insurance. That's like, is this really what you're wanting to do? Is this filled out correctly? And from there, your claim could be rejected. In other words, like, ew, get out of here. We're not sending this to the insurance company. Usually that is where there's an error on the claim. There's some kind of discrepancy. The service being billed is incorrect. Maybe your insurance member number, the ID number is incorrect. So that's usually where that one gets caught up. Then once it gets to the insurance company, that claim is again reviewed and they decide whether this is a medically necessary service that you got. And if they decide, yep, and if everything looks good, which hopefully it does, because we already went through that initial review, then you go to stage 4, which is where the claim has been accepted. And then eventually it has been, sometimes they call it processed, sometimes it's called paid out. But in other words, the money is now being sent from the insurance company to your provider, who will then get back to you with your outstanding balance. So that's the process. And usually if there's an error in the claim, it's before the claim even makes it to insurance. And you can call your provider and ask them, but see, this is the part that's complicated, is like, if you're in a larger system, it's so hard to get your provider to do something like this for you. And I just want to validate that this is hard to get somebody to do, but you can in fact ask them, hey, can you just see where my claim is in that queue? And that'll give you a sense. And if it's a recurring service that you're getting, like for me as a therapist, I can pretty much tell somebody how long it takes for their claims to process because I'm submitting them all the time. And everybody's got a different lag time. For some folks, their insurance pays out like the next week or maybe within a couple of weeks, which is so speedy, so speedy. For other folks, they're a January person. So it's like, oh, wow, seasons have passed, leaves have fallen, babies have been born, and I'm finally hearing back. And again, if that's the case, that would be good information for you to know, because it's not that that one claim is being submitted slowly, it's that your plan pays out slowly. And that's going to affect all of the healthcare that you're receiving, regardless of what kind. But anyway, so that's like a very long answer to try to be instructional, but hopefully that's helpful. And feel free to circle back with like who it is specifically. And I can give further non-financial, medical, or legal advice.
No, that is helpful. And just a quick follow-up. Let's say I get a bill. It's not a crazy bill. And I'm still kind of like, but I'm worried because I hate having things that are owed. So I pay it. And let's say I shouldn't have paid it. Let's say the insurance should have paid it. Do I then ever see that money again? No,
No.
don't pay it.
Well, you're not going to hear me weigh
Yeah.
in on that.
Yeah.
But hopefully you now feel empowered to make better decisions.
Great.
Yeah.
Okay. That's helpful, Fern. Thank you.
Yeah. You're welcome. Any other questions that might be beneficial for our later audience?
Fantastic. Well, I am going to stop our recording here. Thank you, faraway people that we'll never meet that watched this video, and I hope this was all informative. And now we're going to go to our private Q&A. Hold on.
Great. Good luck out there, everyone.